So hi, my name is Komal Hombal. I'm a fourth year medical student over at Albany Medical College. And just a little bit about me, I'm hoping to apply into internal medicine this year for residency. And I'm excited to talk about my project that I've kind of been working on for the past 3 years now with my mentor, who's a gynecologic oncologist here at Albany Medical Center. And the topic of my research is regarding anxiety in patients with gynecologic oncology, specifically those who don't know for sure if they have a malignancy yet, and they're just at the stage at which they're suspected of having a malignancy. And specifically for patients with ovarian, cervical, uterine, and vulvar cancer. The way I kind of got initially involved with this project is after meeting with my mentor, he had mentioned to me a phenomenon that he noticed in his patients where first time patients suspected of having a gynecologic malignancy kind of were experiencing a high level of anxiety. And this is something that he believed was an unnecessarily high level of anxiety. And he didn't know, but he suspected that this could be partly due to inadequate counseling or education that was being given to patients at the referring provider level. And just for like a little bit of background, typically patients come to the gynecologic oncologist most commonly from like general OBGYNs, but they can also be referred from like the emergency department or from primary care physicians. So there's not really like a standard process for referring patients and like a standard process for the counseling and the education that they receive. So that's kind of what sparked this study. Our project, we kind of had two main aims. One was to look at patient anxiety levels at pre-consultation and at post-consultation with the gyn-onc, as well as looking at patient understanding of their cancer diagnosis. And that was done by a survey that we actually came up where patients could indicate their on a Likert scale how much they agreed with certain statements like I understand the plan for my diagnosis or the information that my referring provider provided me with was adequate. So in that way, we were able to measure how much patients understood their own diagnosis. And then we used something called the STAI or the Standardized Anxiety Inventory to come up with to figure out their anxiety levels at pre and post consultation, as well as just gathering some demographic data, such as like their age, their race, what kind of cancer they were suspected of having, how big this potential mass was, just to kind of help us see more if we wanted to explore certain subspecialized in our data. So yeah, so we did that. This was a survey study, so we initially collected all of this information through surveys, and we found that at the end of our study, there was a very significant decrease in anxiety levels and a very significant increase in patient understanding at post-consultation compared to pre-consultation. So there are many different validated questionnaires out there that are measuring anxiety. I think we specifically chose the state trait anxiety inventory because it felt like easy for patients to understand. It didn't require a lot of instruction on behalf of the person administering the survey, which in our case was often like a nurse or some administrator. It wasn't the physician directly. So it was easy to just use the survey because it was very self-explanatory. It has statements such as like I feel confused and I feel worried or I feel strained. And patients are just able to indicate on like a scale of 1 to 5 of like how much they agree with this statement. So we just felt like it was a very like simple way of measuring anxiety. And it also, because we used the same scale at pre-consultation and then they filled out the same form at post-consultation, it was also, I think, less confusing for patients because they were seeing it the same thing for the second time. And it also made it much easier for us to just compare directly between pre and post. And the way that we did that is you compiled the score for these 20 questions, and then you were able to like compare that to a numerical score at post consultation. The goal of our study was meant to be more of like an exploratory study where we were just looking at the current levels of anxiety in patients. And I think that like further down the road, we would like to explore like why exactly patients are experiencing this high level of anxiety, and also from like the physician perspective of like what they're currently, or if there are any tools that they're currently using to counsel patients. And we found that like from our demographic data, we also were collecting like the information of how long patients were waiting to actually meet with the gyn-onc for the first time. And we found that it was from anywhere from like a couple days to like up to a month. So this is like a pretty long time for patients to just be sitting with the possible cancer diagnosis. And while we do understand that like this is in itself like very anxiety provoking, we do feel like there are some ways in which we can mitigate some of that anxiety. And I think that one of the ways to do that is just with better education and better communication with the referring provider. I actually, when I presented this poster at like a local like MSI, like medical student investigation day, I was able to speak informally with like some general OBGYNs, and they were able to tell me like what their referring process looks like. And they did tell me that like obviously there's a lot of different circumstances in which patients are referred to the gyn-onc. So it's not always possible, depending on the circumstances, that they have like an in-person conversation with the patient, or they have like what's called like a warm handoff with the gynecologic oncologist to just like introduce the patient to them and get to know their story. Well, I think the first thing, which I kind of mentioned before, but is to determine like how physicians are currently referring their patients. And I think ultimately, if we find that this would be helpful, one of our goals would be to come up with some type of like recommendation or like some tool that physicians can use when counseling their patients, whether it's like a pamphlet or like something that they can physically look at. Um, and I think each provider has a different way of counseling their patients. So I think a good first step would just be to poll physicians and see what the current practices are. And also, I think that we do, like right now, we have the survey data to say that, yeah, patients are experiencing this high level of anxiety. So I think the next step on the patient side would be to maybe conduct some interviews with patients and see like why exactly they're having that anxiety. Is it because they don't feel like they're receiving enough information from their referring provider, or is it something else that we can address in a different way? So I think before we say that all of this is because of inadequate counseling and education from the referring provider, I think it's important to explore that further and see if that is the case. Um, and yeah, I think ultimately the goal is to see what would help patients, or sorry, help physicians in counseling patients, whether that means like personalizing a care plan for each patient and coming up with things that to address their individual needs. Like for example, if you know a patient has a high level of anxiety or depression, and that's like been documented in their past history, you might offer them different services than someone who doesn't have that history.